what is the best way to allocate public funds in order to obtain the best health for a population? In order to find answers to this and other questions, our researchers went to the field to learn and document the best ideas that aim to guarantee better health and quality of life. Independent of economic policy, most developed countries provide their people with tax-financed healthcare systems. And even in more conservative countries where healthcare isn't treated as a basic right, public spending on healthcare is high. In Brazil, the Unified Health System, SUS, was created in 1988 with the aim of universal healthcare access. Together with the private health insurance system, it serves a population of around 200 million inhabitants.
Saúde não é simplesmente a ausência da doença. É bem-estar social. É momento de pensar de quais são as possibilidades reais e concretas que nós temos de mudar esse sistema de saúde hoje no Brasil.
O debate sobre saúde foi intenso para definir o texto da Constituição. Saúde passou a ser direito de todos e dever do Estado e foi criado o SUS, o Sistema Único de Saúde.
O documento da liberdade, da dignidade, da democracia.
Throughout Brazil, the organization, financing, and efficiency of the public healthcare system has been the subject of intense debate, and the problem of access to quality medical care and medicines has created numerous critics of the existing system.
Pacientes reclamam da falta de remédios de uso contínuo nas farmácias da rede pública.
Filas e muita espera por atendimento. Esse é o retrato da saúde pública em grande parte do país.
O problema vai desde de infraestrutura até recursos humanos.
This system used today in Brazil was inspired by the National Health Service, NHS, in the United Kingdom.
Read it carefully. It tells you what the new National Health Service is and how you can use what it offers.
Created in the 1940s, it was one of the first public healthcare systems with universal access as its promise.
It will provide you with all medical, dental and nursing care. Everyone, rich or poor, man, woman or child, can use it or any part of it, but it is not a charity. You are paying for it mainly as taxpayers, and it will relieve your money worries in times of illness.
It is used in England, Wales, Northern Ireland, and Scotland, covering about 65 million people. And despite having very similar health systems, each has the freedom to organize its own NHS. So, looking for a better understanding of the NHS in Scotland, our team traveled to Glasgow, the largest city in the country, to learn about and study how health policy and access to medicines work in the country, and also to learn about an innovative new project to improve the quality of prescription medicine and help make medical treatments more effective. The pharmaceutical market has thousands of medicines. Because it's a very lucrative market, new drugs are being launched every day. And one of the biggest challenges in healthcare systems worldwide is the unjustifiable growth of new treatment prices. In Scotland, access to medicines, even those of high cost, is guaranteed to all inhabitants through public funding. But as public systems are financed with tax resources, when we choose to purchase high-cost drugs, the same resources will not be available for other health treatments, which leads to the challenge of choosing which technologies and medicines are really useful for the population. And in Scotland, who will make that choice is the Scottish Medicines Consortium, known as SMC.
We look at the company submissions for the new medicines, to look at the clinical evidence, the health economic evidence, and to compile a report that goes firstly to our new drugs committee to look at the evidence for the new medicine to determine whether it's going to offer value for money for the health service in Scotland. And after that, the submission goes to our main decision-making committee, the Scottish Medicines Consortium.
The SMC was established in 2002 and is made up of health professionals, representatives of the NHS, the pharmaceutical industry, and the public, all with voting rights. Most SMC health professionals have a direct role in patient care, ensuring that the views of patients and caregivers will be taken into account during decision-making. But how does the SMC decide which drugs should be provided to the population? When considering a new drug, they are evaluated how well the drug works, which patients would benefit from it, whether it is as good or better than the drugs that the NHS already uses, and if it has a good cost-effectiveness ratio. In England, the National Institute for Health and Care Excellence, NICE, created in 1999, is the body with similar attributes to SMC. And in Brazil, responsible for this work, CONATEC, the National Commission for Health Technology Incorporation, in SUS, established in 2012. It assists the Ministry of Health on assignments related to the incorporation, exclusion, or modification of health technologies provided by SUS.
A CONITEC é uma comissão que assessora o Ministério da Saúde nas questões relacionadas a tecnologias. Então, quando precisa se julgar se uma tecnologia vai ou não entrar no rol de tecnologias que são subsidiadas pelo SUS, pelo Sistema Único de Saúde, a CONITEC entra em ação para esta função.
A CONITEC é uma comissão multi-institucional, pluralista, funciona como plenária, se reúne mensalmente. As análises que são encaminhadas são feitas por núcleos de avaliação de tecnologia em saúde alheios ao Ministério da Saúde.
A CONITEC é formada por um plenário e uma secretaria executiva. A secretaria executiva é responsável por fazer toda a análise técnica e administrativa que vai subsidiar o plenário para deliberar sobre a incorporação ou não de determinado medicamento. O plenário é composto por 3 instituições. Todas as secretarias do Ministério da Saúde, Anvisa, ANS, Conselho Nacional de Saúde, CONAS, Conselho Nacional dos Secretários Estaduais de Saúde, CONASENS, Conselho Nacional dos Secretários Municipais, CFM, que é o Conselho Federal de Medicina. Então, esse plenário é que vai avaliar e recomendar a incorporação de um novo medicamento, produto ou procedimento no SUS.